You're listening to In Sickness, a podcast about caregiving with Allison Breininger and Justin Bima.
Right. Hi, friends. Justin was not able to be here with me today, but I am so excited to introduce you to our special guest, Dr. Zaider, a licensed clinical psychologist with expertise in couple and family therapy. She provides oversight of the family therapy clinic housed within the Memorial Sloan Kettering Counseling Center in New York City. She's here today to talk with me about how caregiving and illness can impact physical intimacy between partners. So, Dr. Zaider, thank you so much for being here on the In Sickness podcast.
Thank you. It's a pleasure to be here.
Yeah, this is a topic that many people that I coach have sort of come to me in whispered voices and have said, is this something that we're allowed to talk about? And so we've been very excited to do this episode, and I'm really glad that you're here. And I think that a lot of people will be very relieved to hear you talk today and to realize that they are not alone in this subject. You know, we talk a lot about caregivers. We feel very alone, but I think this is even kind of a nuance within caregiving that is even less talked about. So I'm really glad that we're going to have this space today to talk about this. So in your work, you support families going through serious illnesses. And so share with us, what are some of the things that you hear from couples about how illness and about how caregiving have impacted their sex lives?
Yeah. Thank you. So I've been a psychologist at Sloan Kettering, which is a cancer center now for about 17 years. And as you said earlier, I primarily work with couples and families who are affected by cancer of all stages. And, what's interesting is that you mentioned the hushed tones. Intimacy is often not something that couples present initially talking about right up front, but it's almost always something that couples will say has been in some way affected or disrupted by the presence of an illness. And they'll talk about it in a lot of different ways. So, couples who are in the throes of the initial diagnosis or treatment planning phase of illness will often find that they're in a kind of crisis mode. And so intimacy feels like something that gets sort of put on the back burner temporarily. And for those couples, the idea of getting back to some level of intimacy afterward can be a challenge, just readjusting and thinking about paying attention to that part of their relationship again to begin with. For other couples who are dealing with or living with really chronic stages of illness or ongoing treatment, or are living with a condition that has sort of a relapsing kind of nature, figuring out where to fit in intimacy and how to define it in their relationship is a big challenge. And often these are things that don't easily get talked about.
Right. Yeah.
So often that's the thing that we're doing first, is just, seeing whether we can have a conversation about what that is.
And can you talk about, like, what are they, when they come to you and they do finally, you said it's not one of the first things they talk about, and maybe it takes a while to be able to like get them to open up to even talk about that this is something that's going on. But what are the things you hear from them about the challenges that they're having? What does that sound like?
So depending on what the nature of the physical relationship was before the onset of an illness, there's so many challenges to thinking about physical intimacy, physical contact again. So one of them is just dealing with symptoms. So all of the effects of medical treatment and perhaps the illness itself can get in the way. Things like fatigue, nausea, pain, changes in a person's body due to surgical interventions, or certainly changes in self-image or body image resulting from surgery or treatment. All of those things can very profoundly change just the physical experience of one's body for the patient themselves, and then, of course, for the partner. So one of the challenges just has to do with dealing with these symptoms that can make it difficult in very concrete and practical ways to be close again in the ways that, a couple might have been used to or has been able to do routinely before. One of the things that couples often talk about is that their sense of spontaneity around physical contact is no longer there. So before, we used to be able to rely on just natural sex drive to get us started, or a sense of desire to get us started, or under the right conditions, we could kind of, drum up just interest.
Yeah.
Or we knew how to turn ourselves on. We knew how to turn each other on. That's no longer, a given. So couples will say that they can't rely on that being the starting place for physical intimacy the way it was before. And so we have to figure out how to get started to begin with. Couples will often, it's funny when I bring this up and ask about it, and I always do at some point, often they'll look at each other, and there's definitely a sense of recognition that this is an important part of their relationship, but also kind of a sheepish look they give to each other, like, oh boy, this is something we really haven't engaged yet. So the other challenge that couples can talk about is that they can feel very protective of one another. And again, especially if there are changes that the patient's experienced in their own body, symptoms that they're dealing with that might constrain or keep them, limit them in some way from being physically involved with each other. Patients and partners can in some ways prefer not to talk about it because it's difficult to face and accept the limitations or losses that are there. And so there can be this sort of withdrawal that happens. We've just sort of put this down, or we've made it not less important in a sense.
Yeah.
Because we don't want to distress each other.
Right.
So that kind of protectiveness from emotional distress can be another reason why couples have stopped engaging each other, stopped, sort of making efforts to restore any kind of physical intimacy. So there's the emotional distress, there are the physical limitations. There's the, I would say along with those physical changes, the loss of libido, the loss of sex drive that might be there for one or the other partner. Again, as I said before, makes it difficult to know how to start. And the things that they could rely on before are no longer there. And then, I think there's also, couples can also experience a real loss of balance in the relationship when their roles have changed dramatically. So we've gone from being partners or co-parents or lovers to patient and caregiver. And, this is something I know comes up a lot for caregivers, is this idea that they are now in this role of taking care of. And that too can be difficult to think of switching out of and back into the role of a partner who's also, connecting physically and sexually.
Right. I was just listening to a podcast of Esther Perel the other day, and she had a couple on, and he was a vet and had a lot of PTSD, and it was on this very topic. And the wife said, I feel like I'm his emotional support animal. Like I wake up and I'm just on alert, and I'm watching for anxiety, and I'm watching for these symptoms, and that's not sexy.
Yeah.
Right? And it's like, she said, like, I'm also, you can get this picture in your mind of this like Saint Bernard or whatever, right? That's like sort of just there is like this help and this coziness and watching and alert, but not sexy. And so she talked about like, I feel like I'm your nurse and not, and then that it feels hard to switch from being your nurse into being, your lover.
Yeah.
And so is that something that you hear from caregivers, is just sort of that role switching of like, 1 minute somebody said to me that I was giving him a shower and not in a sexy way. Right. Right. And so she's like, so then it's hard to go from like cleaning up that stuff to wanting to do this other thing with the same body. Right. And so is that, are those, what are other types of things? Is that common, or what are other things you hear from caregivers actually in particular?
Yeah. Well, what's interesting is because I see the couple together, caregivers are, again, because of that protectiveness, can be very reluctant to say that out loud. Yeah. So that's the kind of thing that will absolutely come up when I'm meeting with a caregiver one-on-one, and can be really a good reason to have that opportunity for one-on-one sessions with a caregiver. I think there's a need to have some safe space to express that and have that validated and acknowledged. But in the context of the couple, often I'm finding that they need help talking about those parts of the experience that can feel difficult to talk about, where there can be some sense. So if I'm saying to my loved one, this, I'm happy to do I'm doing these things, and helping you in these ways and supporting you in these ways. But they're also, it's hard for me to switch into also feeling attracted to you an hour later.
Right.
That can be a very difficult thing for a caregiver to say, to express directly to their partner.
Yeah.
And so often in the context of couples work, there can be so much guilt or shame around that it doesn't get said. Actually, it doesn't get expressed, but it's felt, certainly. And I think that's a very common experience, and one that really needs to be acknowledged and normalized so that it can be talked about.
Well, and I wonder, even because the examples you brought up, some of them were when you talk about physical differences and loss of libido and surgical changes and body image, right? So that's coming from the patient, if we say that, and then you talk about from the caregiver side that it could be things like loss of interest because of the role changes and exhaustion because of the role, these things. And so it's like both of them have these buckets potentially of reasons. And it's interesting that, if there's anywhere where the two of them could talk about it, it's with you, right? The couples therapist, but but hearing that people want to be protective of each other, right? Because it's not like, oh, you cheated on me, right? It's not like some of these other things. It's like, this is nobody's fault, right? And yet it's really, really hard. And so do you have, how do you handle those situations, and how can couples get past that sort of protectiveness? Because like you said, some people just sort of like, they just stop talking about it altogether, and they're like, I guess this is just not part of our life anymore. Yeah.
Right. Yeah. On that note, that for caregivers especially, I think it can seem almost antithetical to their role as a caregiver to also have these and express these other needs, or have these other feelings in response to the person's body, their, the aversions they might feel, the loss of attractiveness they might feel. It's difficult for me. So as a caregiver, it might be difficult for me to express that to my partner, not only because I'm being protective of them and don't want to distress them, but it also feels somehow antithetical to my role. And it sort of violates almost like an implicit contract here in terms of what I'm supposed to be doing. And if I'm supposed to be taking care of you, then to express these difficult feelings and ask you to hear them and understand them and accept them feels as if I'm not really taking care of you in a sense.
Yes. I'm having this big light bulb moment. Can I just jump in real quick? Because, so much of what I do with the negative space and with this podcast is help caregivers realize that they're part of the story. Because caregivers, not talking about this necessarily, I haven't thought about it in this context until now, but caregivers think like, it's not about me. Like, I don't get to complain. I'm not the one who's sick. I don't get to be cared for, right? Like we've done, are you familiar with the ring theory?
Yeah.
Yeah. So we talk about, we're always in ring number 2. We're never in ring number 1, right? And so it's really interesting to think about how all of that, like if I feel like I'm not part of the story and I don't get to complain, certainly then I'm not going to say to the partner, like, it's hard for me to have lost this part of my life. It's hard for me to not be able to do this. It's hard for me to tell you this. It's hard for me I think the other piece is like that we are not used to being cared for. And in this sexual experience, like, right, part of that is that like, hopefully that we're both part of the picture. Right. And if caregivers are like, wait a minute, I am not used to people doing nice things for me, right? We've sort of shut that part of us off because we're so used to being the caregiver, right? And so, go ahead.
Yeah, no, the counterpart to that is that the patient carries the responsibility of having this condition and having this impact because of their condition on the caregiver. So one of the early shifts that I tried to make with couples is from this idea that this is your illness and I'm, you're the patient with the illness, I'm the one with the caregiver, to more of a what we refer to as a we position. This is our challenge to deal with together and to manage together. And that includes not just managing the condition itself, but managing the difference in our sexual needs, for example. the difference in our, or the discrepancies in terms of our capacity.
Mm-hmm.
Just to take a step back here, I do want to say just more broadly, so even outside of the context of illness, every couple will go through phases where things like libido or sexual interest or ways of staying connected sexually are going to change.
Mm-hmm.
I mean, if you think about sort of how intimacy evolves over the different seasons of a couple, of a marriage over time, there will be fluctuations. And part of the task, in a sense, the kind of normative task of any couple is to figure out how to adapt to those changes over time. And so I think it's helpful sometimes to hold that as just the more general kind of way of thinking about what intimacy typically does in a relationship, and the ways in which then the presence of an illness can make that task just more difficult in a sense. I often will say that, an illness like cancer is almost like a third member of the relationship. There's a way that the couple has to figure out how to make it fit with all the parts of their relationship that are important to them. And if sexual intimacy is one of those parts, then we have to figure out how to maintain and preserve a sex life for some kind of sexual intimacy, while we're making room for this illness.
Right. And what about, because I know that your specialty is in cancer, working with cancer patients and their caregivers, but we have a lot of listeners where it's chronic fatigue syndrome, or it's, POTS or traumatic brain injuries, right? And so just want to sort of clarify that, like, this is not just a cancer thing, right?
Yeah. In fact, I would say often what I'm working with is the aspects of a cancer diagnosis that can prove especially difficult for couples in this area is really has to do with the chronic nature of the disease or treatment. Yeah. And that is something that I think would cut across all of these conditions that are where couples are really dealing with something that is chronic.
Yeah.
Now, each of these disorders or conditions might have different patterns to them, right? Mm-hmm. So for some, there might be periods of stability and health followed by a relapse. For others, there might be more progressive. So that will have something to do with how couples ultimately manage this and find room for intimacy in there.
Yeah.
But, the common thread here is that there's something that the couple is needing to adapt to and find their way around. And the couples who do that successfully, I find, and this is borne out in some of the research in this area too, tend to approach it from this we position. So rather than dividing ourselves into patient and caregiver, where you have the disease and I'm here required to just accommodate it, this is really both of us are dealing with this disease and all of its secondary side effects.
Yeah.
And it's our responsibility together to manage it in a way that meets both of our needs.
Yeah. Yeah, absolutely. When you said the thing about that some diseases have different sort of seasons, and that a caregiver I know said recently that, like, her person was in a good season. And so suddenly, because she wasn't in this sort of panic mode, like you said at the beginning about when you first get the diagnosis, you're in crisis mode. And so everything else kind of gets put on the back burner. And because they were sort of in a quieter season, all of a sudden she was like, wait a minute, and was having all these feelings of like, oh, this is something that we used to do, but then realizing, but we are in a different world, But so I think just the realization that every season can feel different, and that she realized, like, this had been something that was just on the back burner for me. And that now that there's a little quiet time, right, that it's something that she was sort of like reawakened in her, and she realized, and now is realizing that it's missing from her marriage. Whereas before it was sort of like, of course that's not happening,
right?
Because all of these crises are happening. But now that they're not in crisis mode, is she's just now coming to realize that, like, oh wait, this is something that's missing. Even though the crisis isn't happening currently, Yeah.
It's interesting because I find often that it's that kind of shift from crisis mode to a period of stability that can actually be extremely challenging for couples, for patients and caregivers.
Yeah.
For one thing, they might be making that shift at different paces. So you might not be in crisis mode anymore,
Right.
but I'm still holding a lot of vigilance. And the idea of getting back to some kind of physical intimacy can seem very exciting to one person and not to another. There can be pressures felt to use that period of stability, use our good moments to maximize the quality of our relationship and our bonding. And that pressure can work against us in some ways. There can be assumptions about a person who is maybe no longer acutely ill, but still dealing with a lot of residual side effects and maybe not ready to make that sort of switch back to so-called normal. So that can be actually a period of real tension for couples, ironically, which can surprise people and be confusing in a sense because medically we're doing well, but in our relationship and family life, we're feeling still.
Agreed. Yeah.
Yeah.
And I think that, and it's actually your colleague there, Allison Applebaum, that I have seen has done this chart about the stress for caregivers at different stages. And I've certainly felt this myself, that when I was in sort of a quieter stage of my life, because I quit my big job to do this, that's when all the feelings and the emotions, and that's when I was sort of in my worst emotional state. And I've heard that too, that, people who like the patient, once they sort of leave the hospital and can start doing some healing, they are eventually are then able to feel some of those feelings. But the caregiver is in even more caregiver mode in that moment. So it takes a while. And so, like you said, those moments can happen at different times for each person. So what happens when one member of the couple is like, this is something I'm interested in, this is something I would like to be doing, and the other isn't? And I think I can imagine it could go either way. Right. Yeah. And so how does a couple handle that?
Yeah. So again, I want to just maybe first off say that discrepancy, or what's often referred to as a desire discrepancy, is actually very common in couples in general.
In general, yes.
So just to say that couples go through that, it's normal. And often the first thing I'm doing is normalizing that experience, and making sure that we're not over attributing that entirely to living with illness, but just to say that, again, that's part of the nature of any relationship, will evolve and have those differences. Now, that said, so when I'm with a couple who's describing that kind of difference in sexual interest, so we do a number of things. First and foremost, I want to make sure that they're talking about it. What can happen and what we want to avoid is a kind of mutual avoidance of the topic to begin with. And the reason for that is that if I'm experiencing your interest and am not able to be available to you in the way that you need me to, then I might not just avoid talking about it, but I might start to also avoid any kind of engagement that might unintentionally signal something to you that I'm not available for, right? So what can sometimes happen for couples is that they start to pull away from each other in ways beyond sort of sexual contact, but also include physical affection, cuddling, holding hands, sitting next to each other on the couch, anything where there might be some worry that this is going to put us in conflict.
Sure.
So we want to look out for that. So I'm often asking couples, what are you doing about this difference? Are you talking about it, and how are you talking about it? And typically couples are not openly talking about it. And then again, typically couples are finding themselves avoiding not just the conversation, but avoiding each other as a result. That can go down a road of sort of diminishing intimacy in other ways beyond physical intimacy, and can start to create a lot of tension in a relationship. So we want to find ways for the couple to talk about what's happening, to help understand. We want partners to better understand where the other person is coming from. We want to find ways for the couple to stay connected, even as they're trying to figure out what to do about this difference.
Mm-hmm.
So let's not avoid each other altogether. Let's find ways to stay connected without any sense of coercion or pressure,
Mm-hmm. Mm-hmm.
right? And then the conversation is really, as I keep coming back to, is really the biggest part of what couples are doing, and can feel very new for couples who aren't used to talking about sex
Yeah.
or talking
Yeah.
about their sexual selves with each other this directly and openly. So we're trying to normalize that and help them, help each partner really express what they're wanting and
Mm-hmm.
why and what it means to them.
Yeah.
So if I'm the partner who has a strong interest in being sexually connected again, is that because I'm feeling just biologically a strong drive these
Mm-hmm.
days? I'm walking around horny all the time. I really
Mm-hmm.
just am finding you attractive. I'm drawn, I'm wanting that kind of sexual fulfillment. Is it about that? Is it about I'm wanting to experience myself differently?
Mm-hmm.
I've been experiencing myself as a person who's very vulnerable and ill or frail, and I want to reconnect to my own sort of erotic self, my life
Mm-hmm.
force, my vitality. So is it about that? Is it about wanting care and nurturing? And that's how I feel it. That's sort of my
Yeah.
language for it. Because when we're close physically, I get to feel closer to you emotionally too. So we want to try to unpack what that desire is intended, what the person is really hoping for.
Right.
And then on the other hand, for the partner who might be leaning out of any sexual desire, we'd want to understand both what they're experiencing in their bodies and minds, but also what they're needing to feel connected if it's not going to be physical or sexual.
Yeah.
Under what conditions will they feel most connected to their partner?
Yeah. Yeah, for sure. And how does it work when, the thing that is causing the one person to not have that desire could potentially be hurtful, right? Like potentially the patient says, I see you as my nurse now. Like you were just giving me a shower, right? Or maybe the caregiver says like, it maybe has a hard time saying, but might think like, I no longer find you attractive because this has changed and this has changed and this, you know what I mean? Those are sentences that could feel like that's their truth and can feel extremely hurtful, I would imagine, if said to the person. And so how do they navigate when the truth underneath it is something that can feel really hurtful potentially?
Yeah. Yeah. So it's tough. It's complicated.
Yeah.
So, often I will try to help each person work out those feelings individually.
Yeah.
So what I'll tend to do in my practice is I'll offer to meet with each partner one-on-one.
Sure.
And give them a space to really articulate and kind of clarify what their thoughts and concerns are about that. And then we find a way to bring that back to their partner. Now, although generally we want in any relationship for there to be transparency and truth telling, we also do want to be protective. We don't want to say things in a way that are going to feel rejecting and injuring for each partner. So, sometimes I'll preempt it by putting out there, and this is where guidance, I think, from someone who's facilitating this conversation can be really, really helpful. So sometimes I'll preempt it just by saying, so many couples bring up these kinds of issues. I'm no longer feeling attracted in the same way, or I'm not feeling desirable myself. When I look at myself in the mirror, if I feel disfigured, or if I've had surgery, or I feel unattractive. So many couples, and I'll sort of normalize first off that these are sentiments that are part of the territory of living with illness. And then I'll invite them each to express, what part of this is familiar to them. And, a lot of this is about really giving permission for people to articulate it, and then being able to sort of grieve together, share the grief of what, the loss that they're both feeling around this.
Yeah.
And I would even argue that a couple that's able to express and share that grief and sense of loss in the limitations that they're living with are going to feel much closer
Yeah.
knit
Yeah.
than a couple that is shielding each other
Sure.
from that.
Yeah. And that was actually a question I got. So I put out on Instagram to our followers, are there, going to be doing this interview? Are there any questions? And one person who is a younger, a quite young caregiver said, like, how do I deal with the grief and the anger and the emotion around knowing that like the sex life that I used to have is probably over.
Mm-hmm.
Right. And especially being, I mean, it's hard at any age, but especially being a young person. And so I think that's really powerful what you said about like grieving it together, because it's possible that if this person talked to their partner would maybe say the same thing. Right.
Yeah.
And so grieving together is one thing, but what would you say to that person about how to handle sort of, if some of this is like inevitable in this potential scenario because of the illness, is there, what does that person do with those feelings?
Yeah. So it's a conversation. Again, I think it's a conversation about, first of all, again, acknowledging the loss.
Yeah.
That's there, the very real, and facing that together. Yeah. So again, rather than pretending it's not there mm-hmm. or being sort of disengaged from it,
sure,
really being explicit together that this has changed.
Yeah.
And this is a very real limitation that we're now dealing with and won't return mm-hmm. back to normal. And then I think it's a conversation about how we as a couple want to adapt to this. What feels most meaningful to us now? How can we stay present, focused, and be with each other in a way that will matter to us, that will feel important to us, even if it's not the kind of intimacy that we could achieve earlier. A lot of what I do with couples when they're dealing with these kinds of limitations is invite them to consider a more expansive definition of intimacy.
Yeah.
So if intimacy is not going to be expressed easily in sexual intercourse or sexual mm-hmm. contact, how are we going to stay connected and feel bonded to each other?
Yeah.
And again, to do that without acknowledgement of the loss and grief, mm-hmm. I think is skipping a major step and will then feel like misguided kind of advice, right?
Yeah.
So we need to start from the place of acknowledging that reality. And only then, I think, from that place can a couple feel empowered to look at what's possible, mm-hmm. What we can hope for as a couple.
Sure.
There's this idea that Katha Weingarten, a psychologist, talks about reasonable hope in relationships. So what feels like something reasonable that we can hope for mm-hmm. for this marriage. And she also, I think, in very sort of beautifully talks about the ways in which partners can differ in terms of their willingness to engage and experience loss.
Yeah.
And so if I'm really aware of and connected to my grief that our sex life will never be the same, and you're not, mm-hmm. then we're really far apart mm-hmm. in that sense. But it's not enough to be just aware of it and connecting to it. We need to also be able to move into a position of empowerment.
Yeah.
Right.
Yeah. Mm-hmm.
Because otherwise the heaviness of that loss and the impossibility of it can really be crushing.
Yeah.
Right. And we can get paralyzed there.
Yeah. And I wonder if a step, because I love how you said about like, so acknowledging it and then thinking about, okay, if it's not going to work in this way, then what? And I think that maybe for some people, it might be that physically it could still work, but there just needs to be adaptations, right? And it might not look the way it looked before. That's and so right. Is that something that you talk to people about, adaptive? Like I was at Cancer Con, which is for young adults with cancer. And there was somebody from like a sex shop there, right? To talk about adaptive things. And so is that also a piece that you talk about, that it might not look the way it looked pre-diagnosis, but that doesn't mean it can't look a different way, right?
Yeah. So I've been very influenced actually here by the work of Suzanne Iasenza, who writes about, and I think also draws from many other experts in this area around, thinking about sex and the sexual response cycle and the kind of construct, she talks about how each couple ends up having to sort of construct their own kind of model of what constitutes sexual intimacy. So many of us grow up with this model that starts with drive, sexual interest, drive, desire, and ends with orgasm, right? For many of my patients who can't rely on starting with drive, we talk about starting with willingness. So what do I feel available and willing to do in this moment? And that the outcome really that we aim for might be pleasure, satisfaction, a sense of bond and closeness. And so one of the things that I like to do with couples is to think about pleasure, about giving pleasure, receiving pleasure, and all the sort of sensory or sensual experiences that can get them there. And I'll invite couples, again, this comes from Suzanne Iasenzo's work. I'll invite couples to draw up a sexual menu, we call it, where each of them each partner might make a list of 5 or 6 things that they would say bring some amount of pleasure to them. And they don't have to be frankly sexual things. They can be, really anything. Watching a sunset, going on a walk, a movie, reading erotic literature. They can be anything like that.
Yeah.
And we'll have them do that and then come to a session, exchange those ideas and pick from each other's menus to just start thinking about steps they can take to generate more pleasure in their relationship. So that would be an example of a kind of adaptation that we might make to whatever they were used to before, that might look different, but still holds a lot of possibility in it.
Yeah, that's super helpful. I want to talk for a minute about sort of when the sort of the mental health aspect. So one of the people submitted a question and said, what about if her person has mental health challenges and then she's concerned about consent, right? About like making sure that her person is mentally there enough to be able to know that he is consenting. And so how does the sort of the mental health aspect of this come into play?
So certainly things like when I think about mental health issues that might get in the way, so certainly things like anxiety or depression. There can also be, of course, in certain conditions, cognitive effects of a disease that can limit a person's capacity to, you might wonder about their capacity to consent. And so we're always wanting to support each partner's autonomy first and foremost, right? So those boundaries, the personal boundaries of the self, are really important to be protective of. So I mean, I think it might help to think about a specific example in terms of mental health issues like that, but certainly again, and especially with the guidance of someone who can help facilitate these conversations, I'd say that, I'd want to make sure that your partner understands and is willing to participate in any kind of physical contact with you. And that if you're, I'd say if you're feeling unsure about their willingness, that would be good reason to pause and continue to check in. Absolutely.
Yeah. So many of the things you've talked about today are about, the conversation and the connection between the two. And like you said, even when you ask them in therapy, often they haven't had that conversation. And even with you, a skilled professional, they have a hard time. And so do you have any tips for listeners about how to sort of broach this conversation with their loved one?
Yeah. So, I sort of want to say, just do it, right? There's a bit of just sitting down and saying, listen, I want to talk about our physical relationship, or I want to talk about what's going on physically for us. I think, the general guidelines around communicating about difficult topics that I use when I'm helping couples with this are things that I think have become very popularized, so are probably familiar to many people. So if I'm going to bring up a tough issue that I worry might be distressing, I want to do it in a way that's going to minimize my partner's defensiveness as much as possible. I want to do it in a way that's not going to sound critical. And even if I do everything right, I still, of course, can't be sure that my partner will be responsive in the way that I want them to.
Yeah.
But I want to I think this is not a one-time conversation. I think it's something that we want to check in about often.
Mm-hmm.
And so I want to start out really with what we call an I statement, right? So I want to focus on what I'm feeling, what I'm worried about, what I'm noticing. You know, I've been noticing that we really haven't been that physical with each other, and it's something that I'm realizing I miss. I really miss that. Or I'm finding that it's something I miss, but I kind of have mixed feelings about, and I'm wondering if you feel the same.
Mm-hmm.
You know, anything like that, where I'm really starting with, here's what's happening for me
Mm-hmm.
and what I'm noticing about myself. Would this be a good time for us to talk about it? Would you be willing to chat about this? Would you be willing to talk to someone else about it? You know, there's no one size fits all here. And I think you kind of have to know your partner and what would feel natural for you.
Sure.
But it's always better you want to give your partner an opportunity or an invitation to talk about this stuff rather than sit with a lot of assumptions that it can't be talked about, which can then breed all sorts of, negative feelings in a relationship.
I wonder if it's one of those, it's sort of like we talk on this podcast about death, right? And we've had a death doula on, and I wonder if it's one of those things that once it's in the air, that perhaps there's some relief, because maybe it's been this elephant in the room that neither person has been talking about, right? I mean, that's a hope that perhaps, I think that things like this podcast can be a really good opener. And so often we say that when people are like, how do I talk to my mom who's not being very supportive of this thing or whatever? I'm like, tell them to listen to the podcast, right? So listeners, one way you could say is just sort of like, hey, you know, that podcast I listened to, they just had this person on and they talked about intimacy, and I want, you know what I mean? And so to use this as a springboard, and even to say, do you want to listen to it? I'll listen to it, and then we can chat afterwards. And so kind of to use us as an excuse so that it doesn't feel like it's so out of left field, but instead it's like, oh, guess what just happened today? Maybe we should talk about that. So anyway, that's another idea that we're happy to be here. And we're also going to have a support group about this, listeners. So if that would feel helpful, you can use that as well. But before we end, I'm wondering, is there anything that we haven't covered yet that you feel like would be important for our listeners to hear from you?
You know, I think the toughest thing often is for both patients and caregivers to acknowledge these very difficult and sometimes confusing feelings that each of them might be having that have been sort of put away or marginalized in the interest of survival. And when I think about what those feelings are that are harder and maybe feel less permissible to express, it would be anger, right? Anger that this has happened to us. Anger that sometimes couples will feel, even when we discuss all these techniques and strategies and adaptations, will feel angry that they have to do this.
Yeah, right.
You know, that this is what, that it used to be easy and it's not easy anymore. And loss. And really loss is sort of, I think the elephant in the room often is that we are not the same, and you've lost something about who you are, and I've experienced a loss in my partner and a loss of myself. And this relationship is not what it used to be in certain respects. And again, I think I can't emphasize enough just how important it is to start from a place of being able to acknowledge and make understandable these parts of the territory you're in as a couple, and to know that these are really parts of that territory and not necessarily a reflection of the strength of this relationship. So I do think that's important. And sometimes that can happen through these podcasts and through the voices of people, fellow travelers and people, in the trenches, which I think are so critical. And then sometimes it can also be validating to hear it from someone like me, who's been able, whose expertise, I would say, is more in being able to draw together the stories of so many other families and couples than anything else, and say, I've heard this before.
Yes. Yeah.
This is right.
Yeah.
So I finally, I just want to say that I've seen such incredibly inventive ways that couples have found to be resilient
Mm-hmm.
in the face of these kinds of limitations, and so that's been just very heartening and inspiring
Mm-hmm.
that I've had the privilege of seeing couples find their way through this, and often what helps them do that is a relationship where they're willing to be honest and vulnerable with each other.
Yeah. Yeah.
So,
I think a huge takeaway for me today is the piece about thinking about what part of it is that is being missed, and that I think that we feel like we can feel like it's just sort of clean cut. And like, of course, it's just this. But when you sort of listed all of those different reasons that a person might be missing that intimacy with their person, and then it's more about how can we fill that need, I think is really, really powerful.
yeah.
We always like to end by talking to supporters. So people who might not be a caregiver, but have caregivers in their life, because everyone does. And so thinking about, I have thought of a couple, and then if you have any you want to add, please do. But I think one piece is just supporters to be sensitive. If you're sitting around and people are starting to say like, oh, let's all talk about our sex lives, or let's, how's it, just be sensitive to that. And is there a way that you can steer the conversation somewhere else, or to be sensitive to, just because your friend is the certain age or is a newlywed or is whatever, that maybe it's more complicated. And that's probably true for anybody in the room, let's be honest, but especially to think about your caregiver friends. And then I think the other piece is like, if you are a trusted friend and you do feel like you have a caregiver in your life who, maybe is feeling like you're a person that could approach this, if you feel like your friend could handle that conversation, that they might be sitting there with no one to talk to about this and not feeling like they're able to talk about it. And so if you do have a person who's close in your life and you feel like that would be a welcome conversation, to maybe broach that with them and let them know that you're a safe person to talk to about that.
Yeah.
Other things you might want to add about what supporters could do?
I think sometimes being sensitive, but also curious, and allowing yourself sometimes to be educated about this experience that might be different than one you've had, but still meaningful. So, we want, I think, caregivers to feel that they can talk about this stuff.
Yeah.
And that there's interest.
Yeah.
There's interest in my experience too.
Okay.
Rather than it feeling like something I have to, can't be handled, that I have to protect everyone from. So.
Yeah. Yeah. Okay. I'm so glad that people like you exist. And I'm also feeling a little shocked as I think about how many appointments my husband has had in his, 12-year medical journey. And I don't know that anyone has ever asked us these questions. And that feels like a miss in the medical field. And so I know you said that at Memorial Sloan that there's lots of resources. And I also know that that's not always the case. And so caregivers, you might not have medical professionals who are asking you or your person how their illness has impacted this part of your life. And unfortunately, might be another thing we got to go searching for, another thing to add to our list. But just know that the resources are there. They might just not be, someone might not be presenting them to us. And so do you have any sort of overall, like if we can't all fly out to New York City to grab your great resources, but are there sort of general resources, or if someone was looking for a couples therapist, where to start, anything like that?
Yeah, I mean, there's certainly, I know I'm more familiar with the cancer space. So
Sure.
I know that in that space, there are readings and things that have been written about this that can be helpful to look at, just to see that it's something that's on the map and that can be somewhat normalized. But otherwise, I think to some extent, any opportunity to sit with someone who can help guide a conversation, whether it's someone with expertise in this specific illness you're dealing with or not, can go a long, long way. Often I find that just getting a couple in the room and giving them a space, especially couples, if couples are parents or, have very busy lives otherwise, just giving them a protected space
Sure.
to address this stuff is enough and doesn't even require that much sort of fancy footwork on my end or special questions or anything like that.
Sure.
So I would just encourage seeking out that kind of space in any way possible. And sometimes that'll be a couples therapist. Sometimes it will be, a date night. Sometimes, where you can talk to each other about this stuff.
Yeah.
And there are certainly plenty of other resources out there for couples, just in terms of how to engage these discussions. There's a wonderful book by John Gottman, who's a very well-known scientist and practitioner who's developed a very well-known approach to couples work. Mm-hmm. And he has a book that I want to say, I'm not going to say this right, so it's probably best to look up the resource, but it's something like 7 Dates, or it's a book with a series of guided discussions for couples on various topics. And I've had couples use this just as prompts and it can feel sort of playful and more like a kind of game that they play and get to know each other in various respects. And that can be a great resource for just getting some conversations going.
Yeah. Okay.
So, yeah.
And caregivers should remember that, I do one-on-one sessions, and some of the people I coach say, like, am I allowed to talk about this here? And yes, you are. So, just from having, like you said, giving it that space, if you just need a room to process what you just heard, or to even practice sort of having, like, how do you have that first conversation? I mean, you made it sound really easy, Dr. Zaider, and so, but how can you, if you want to do a little role play of like, how do I bring this up or anything like that, just know that I am available as a safe space for you as well. And then keep an eye out, because we'll have a support group where we can come together and talk about this. So Dr. Zaider, thank you so much for your time and your expertise. And it was great to talk to you. And I'm excited for people to be able to have this conversation and your wisdom. So thank you for that.
Thank you. And thank you so much for all that you do. It's really such an incredible resource.
Thank you.
And one that I hope many will have access to.
Good. All right. Thank you very much.
Okay. Take care.
All right.
Bye-bye.
You've been listening to In Sickness. Find us online at insickness.care or on Instagram at insicknesspodcast. You can send your questions and comments to insicknesspodcast@gmail.com. If you enjoyed the show, please share it with a friend or fellow caregiver, or leave us a review on Apple Podcasts. Thanks for listening, and take care.